Mhm. Sounds good.
Hello. We're gonna have folks. I see folks are filing in. We're gonna give them a moment to get through the door. I still see that our attendees number is still ticking up, so I'm gonna just keep waiting until it slows down a little bit. Also getting my notes ready. Sure. All right. We're a minute or two after the hour, but fortune favors the present, so we're just going to get moving on. Thank you for coming to this session of the Be Informed series. We host this every other month. This is handled as a webinar, so all attendees will be coming in on mute. We do ask that you please introduce yourself in the chat. Give us your name, organization, anything else you want to let us know. And then additionally, we really do want to have a robust question and answer portion at the end of this session, or even potentially throughout. So please do in the Q&A box, or if it pops up in the chat box, just get your questions in. I'd also say recommend don't wait until the end to submit your question. Oftentimes someone will say something kind of in the moment, and our presenters might be able to answer in time, or incorporate it into what they're saying. So get your questions in, and we'll be sure to moderate and kind of flow them throughout at the especially at the end, but maybe throughout if need be. We are recording, and we'll be able to share some of our slides after the fact. We'll just make sure the speakers are okay with all the slides being shared, or if there needs to be some removed. If this is your first time attending a Be Informed session, welcome. We're thrilled to have you. Uh, these sessions are hosted by Hep B United, which we like to say is a coalition of coalitions. We have more than 60 partners. This says 50 plus. I need to update it to 60 plus. We have more than 60 partners and national organizations across 20 or 38 cities and 28 states and DC. We have been in operation for 13 years now and really exist to bring folks together who are doing great work in their locations, and might have some really good best practices, and go and make sure that they're able to share those with others, as well as learn from others as well. Uh, our two speakers today are actually involved with Hep B United in some way, as both a capacity, as part of one of our capacity building programs, and as being a longtime member. So I am excited for this Be Informed session in particular. And our mission at Hep B United really is to reducing the local disparities. And we do this around awareness raising, vaccination, screening, and linkage to care. And the last thing I'll say about our coalition is, while we are made up of quite a few different partners, our partners don't look like us. We are all Hep B all the time, whereas most of our partners are focused on their jurisdictional or community health, and Hep B is just one of numerous aspects, including other infectious diseases, reproductive health, or things like high blood pressure or diabetes. The Be Informed series, we host these every other month on the third Tuesday at 3 p.m. Eastern. We try for them to go for about 45 minutes, because we know folks like to have a little bit of time before the top of the hour. But if Q&A is robust, then we'll go the full hour if need be. This came out of a desire from public health advocates and other partners of ours who wanted something a little bit more echo style, where conversations about sensitive or complex topics and really focused on case studies. We normally have a didactic speaker followed by a case study, and today both of our speakers act as both, in that we ask them to come on to share specifically some of the things they are doing themselves. Sometimes we have speakers come on and they're sharing research or other data or helping do analysis. Today we have speakers who are getting their hands dirty, actually doing the work, and so they had conversations with us at the coalition, and we really just were like, other people need to hear this. Let's get you in front of some folks. So we're really appreciative. Uh, and then with that, I'll say, so welcome. This is Cultural Considerations for Hepatitis B events. And we are excited to have two great speakers. Coming out of my home state of Illinois is Dr. Zhang with the Midwest Asian Health Association. And then another great Midwesterner, Sonjay Calamise from Nigerians in Diaspora Organization Americas. We are going to kick it off with what I like to say is the good Maha, or the OG Maha, not this new stuff from 2025. Okay, so I am off of screen share. So Dr. Zhang, would you like to?
Yeah, thank you. Thank you,
Yeah,
Frank, and thank you for Happy Be United to invite me to talk about our practice at Maha in Chicago. As a no, as a no introduction said, the topic would be cultural consideration for Happy B events. I like first to talk about our population. We focus on mainly, primarily Asian Americans and Pacific Islander in Illinois, um, but also other underserved population. So this slide tells the AAPI population in Illinois. It's 901,058 total the population size. Right in 2024, the growth rate is 27.8. So it's a fast growing population in Illinois. The five major groups, it's a ethnic Asian group: Asian, Indian, Filipinos, Chinese, uh, except Taiwanese, Korean, Pakistan, and Vietnamese. The language speaking at home, 63, almost 64% Asian American adults speak language other than English at home. 29.4% Asian American adults are limited English proficient, which means they speak English less than very well. These are the major languages spoken, Asian languages spoken in Illinois, and Hawaiian, Samoan, and Chamorro are the Pacific Islander language. Um, the number is small, and it's above 100 that were counted. The five counties in Illinois have the highest concentration of AAPI populations. The first is Cook County, of course, that's where Chicago is. This is a Cook County, and DuPage County has a growing Asian population, and Lake and Will County. And this is a Champaign County. The state university is there. That may be the reason why the API population is growing there. Um, this slide tells the focused area, geographical area, primary population we are serving. The first is Alma Square, and then also Bridgeport. They're overlapping with three zip codes in Chicago: 60616, 60609, and 60608. 606 are Chicago, city of Chicago zip codes. So this is a Chinatown. Our office, this is at the almost the end of the Cermak road, and they no went worse. And our old offices across the street here on Cermak. So those zip codes are here in this area, three zip code areas. So if you look at the population, the demographics of these two uh, community areas, oh, in Chicago, we have 77 community areas. These are two of the 77 community areas, Alma Square and Bridgeport. So Asian in Alma Square is account for 60%, no, 40% in Bridgeport compared to 10% point 8 in Chicago. But look at the college graduate. So a, a lot of our population are elementary or high school. College graduate percentage are much lower than city of Chicago, especially Alma Square. And foreign-born populations are higher, much higher than that city in the city of Chicago. Limited English proficiency, 33, almost 34% are limited English proficiency in Alma Square. 17.48 are limited English proficiency in Bridgeport compared to 70% in the city of Chicago. I like to compare median household income and per capita income. What this captures most likely is in immigrant household, they're more likely to have a multi-generation uh, uh, no, family. So look at this, even medium household income. You look at both Bridgeport, but especially Alma Square, is much lower than Chicago. But if you look at per capita income, both Bridgeport, Alma Square, um, are lower than Chicago. Poverty rate is high in Alma Square, where these Chinatown located, but Bridgeport also have no part of a Bridgeport. It's no can be Chinatown area. These are some health indicators. Look, the cervical cancer diagnosis, colorectal cancer diagnosis are high, and lung cancer mortality rates are high. But if you look at the screening rates for cervical cancer, colorectal cancer are lower than that of in Chicago. TB is really much higher in these neighborhoods compared to the city of Chicago. TB uh, receive needed care are lower, both in both neighborhoods are lower than Chicago. Adult physical inactivity much higher in Alma Square. And that annual dental screening cleaning rates are lower. Adult loneliness, unmet mental health are also um, an issue in those neighborhoods. You may ask why I don't have hepatitis B data here, because the data is not there in Chicago Health Atlas. So we still over the time data has been improved. The health status data have been improved, but Asian population specific health indicators are not still not available there. Um, no, these what are the bear? You see the data above, but what are actually um, why we have those health indicators, demographics, how that affect hepatitis B educational awareness campaigns. Um, this might not be unique for the community. You might hear in your community too. People do not come out for the screening, maybe because the stigma and the fear of a discrimination. once they are identified as Hep B positive. A lot of times, this is based on literature review, the research, and our experience. We find those um, barriers and challenges. Unfair and distrust Western medicines. Uh, you might also heard in your community too. Uh, what about if I'm diagnosed hepatitis? Is there a good treatment? Um, will I be cared by the providers? So there is a hesitance of um, uh, getting prevention knowledge, getting screened, getting vaccinated, right? And communication isn't an issue because you see in previous slides, there's a low literacy, low no, language English speaking skills in this population, so that prevent them really presented the challenges for them to um, come to approach no, health providers to ask questions, talk about their concerns. And the influence of family and community leaders. I would say a lot of times, whether our community leaders or family are prepared, are ready to talk about certain health issues. So, in your campaign, in our campaign, um, getting community, family to buy in is important. And then I would the language and the literacy also affect the community knowledge of prevention and care. Uh, whether how often I get a screen, I should get a screen. Where if I get positive, where I should get it treated. So that we talk about those barriers is not just finding problems, but by finding problems, we can identify the solutions, right? And also culture, belief, attitude, and health screening, how that affect um, the screening. Um, in our community, in uh, our culture, a lot of times fatalism, uh, karma affect not only we physically identify, uh, no, diagnose the disease, but how we spiritually address those issues. Um, so that a lot of times affect attitude and beliefs affect whether population will take action and get screened or vaccinated. Certain culture practice like shared utensils, meals, um, might have no impact the uh, on the diseases because they can be transmitted through saliva if there is an open wound or and a certain practice no family members may because of culture influence people may not talk about prevention directly among family members um, so that's more likely to for the family members to get infected. Health insurance is a big thing in the community. How get insured? Once people get insured, how to find providers who can see the patients and prescribe medicines, whether you can afford the medication. So that's all intertwined, those challenges and barriers and culturation. Why I want to bring this up because culturation is a big challenge in this community. We have patients who may have multiple jobs or have kids in school, said so their health may not be the priority, or maybe they don't have a car, don't know how to drive, which may become a challenge for them to see a doctor, making appointment, especially women. We find in our community, uh, no women patient may need a ride if they see uh, to do further diagnose care to see doctors. They have to ask their husband to take a time off to drive them to the doctor. Um, to do the screening, further screening and the treatment. So those are all the challenges facing our community. Well, then how you design your program. You know the problems in your community, the demographics, you know the culture challenges. Then how you design a program that are um, that will work. So your campaign messages will address those barriers, including cultural barriers, attitude, and the behaviors. For example, we create flyers to um, each month we create a flyer on different topics. If you live with a family member, how you prevent. If you prevent pregnant, how you prevent. So then you keep sending the message to the community why it is important for the family member to get a screen. Uh, and also we provide translation. All the campaign messages are translated so the population will understand. And then we also do tailor the materials to reflect the literacy level of the service population. Um, so anecdotally, we usually provide more graphics. The language maybe seventh graders, so the people can read, understand uh, easily. So also we hire. I think in the last presentation I talked about hire bilingual, bicultural staff, including community health workers. We call them lay health educators. We have a few lay health educators have who have been with us for since very beginning of the program, uh, in 2012. So they really establish rapport with the community. And also we accommodate the client's schedule and the transportation needs. For example, schedule screening on weekends, and we make a lot of reminders on phone calls on the same day, the events. So make sure the people sign up will come out. Other things we did is one-stop wraparound services because transportation is a big challenge to our community because low income not driving. So we try to build services to make it easier. So they come here to do hepatitis screening treatment. They have other services received like employment, food pantry, insurance enrollment, LAHIP. You expand the programs, but you cannot have all the programs your clients need. So we also try our best to continue build partnership with providers who will have services that we don't provide. Cross referral leverage resources are very important. For instance, the medication we do help assist clients to get medication drug assistance program, but we also refer them to other resources like housing that we don't provide. Very important is confidentiality, private information, identify information, not to release. Even you want to reach their family members, it's always through the clients, not you go to the family members because we don't want to breach that trust. And we do customer satisfaction surveys, community service to ensure qualities. How to become a trusted service provider, mainly through word of mouth, and then you build the trust relationship with the community and through partners and clients will come to you. So these are some of the materials we developed and the events. Look at these. The project board. We had in one summer we have a students from Northwestern University who create this project board with really simple language, a lot of pictures, and so people, clients, community will understand the concept of knowledge. So this is every year in May we do hepatitis D day and also a Asian Heritage Month events in Chinatown and Chinatown Square. So this is a flyer in Chinese, Vietnamese, and English, how to target pregnant women. So the key role, why we needed to consider culture in campaign for Hep B is to ensure the effectiveness and efficacy, because we all know the resources are so scarce in our community. The funding is so small and keep not increasing, but if not, but in decreasing nowadays. So it's very important to consider culture. So your prevention, your campaign will be more focused, more effective. And this is we often use this model. You do needs assessment, develop a strategic plan, program, design your program accordingly, and implementation and evaluation a goals circle to make sure your program will bring the result. So this I leave the question answer in the end. So this is our contact information. That's our office location. These the left column is Chinatown location. This is Bridgeport on Morgan Street, and this is in DuPage County. So you make your service accessible to the community. Um, so that's our strategy. Okay, so thank you so much for listening.
Thank you. Yeah, we'll do Q&A after our next presentation, but please do remember, folks, to put your questions into the chat or the Q&A box. I really appreciated the thorough nature of you showing us the community you guys are serving down to the zip code level. I think that was the median versus per capita is actually a really great trick, and I hadn't considered splicing it that way. I also really appreciate you have just gone and shown us that you can be really thoughtful and well laid out and well planned when it comes to cultural considerations and running campaigns. And I think that feeds nicely into our next presentation, which is a little bit about having to adjust on the fly because of how things are going. So I am excited to kind of be able to see both viewpoints from today. So I'm going to turn it over to Sonjay Calamiz, and you should be able to share your screen. Yeah. Oh, and you are muted.
Okay, let me pull it up. Let's see. 1 second. And wait, I've lost you. Hold on.
Oh, as she's pulled this up, I'll just say that NADOA Ohio chapter is not our current mini grantees. The cycle that just ended in the last couple of months. NADOA was part of that cycle, And in our kind of closing out conversation, part of what you guys are going to hear in this presentation was told to us, and we were just like, oh, hey, this really is something I think others would be interested in hearing, given that we know that others are facing some of these same challenges. So awesome, yeah, we can see it. So I will turn it over to you.
Okay, perfect. Well, I've already been introduced, so I'm just happy to share with everyone my organization's experience with providing Hep B education and awareness. So we'll get into my slides. So we had planned to do three outreach events. The first one we planned on doing consisted of a major festival that happens here in Columbus. It's a festival that is geared towards the African community. Um, in Columbus, I believe the statistics I was told was that there's at least one person from every country in Africa in Columbus. So this festival is very diverse. It was going to provide us with an opportunity to not only reach the Nigerian community who we were focusing on, but also to touch point with other Africans from other African countries. So the second event that we had planned was a picnic. So in Columbus, there is an annual picnic that happens every summer, and this picnic has been going on since the 90s. And it's a picnic that has been put together by various local Nigerian organizations. And the advertisement for this picnic is generally through word of mouth. The collaborating organizations would share with their chapters, different people they know. So we really didn't have to do a whole lot of advertising. Everything was pretty much built in and established since the 90s. So that was our second event that we were going to focus on providing education and testing. And our next outreach was going to consist of media. So we wanted to make sure that we offered digital media as a part of our education. And we wanted to, of course, make sure we had a digital footprint that could be accessed at any time from anywhere. Now, on to our next. So the problems that we faced. Um, so first, we were really excited that we were awarded this grant to work with Hep B United. However, due to the beginning of political changes of this year, we realized that we had to quickly pivot because one of the things that we noticed was that people were not going to large gatherings, they were not going to large events. There just was not a whole lot of socializing that was happening outdoors due to all of the changes. So we we figured we had to pivot quickly, and this is what we did. So the solutions that we came up with were we decided to heavily focus on um, our digital media. So what we did was we created a few YouTube videos that promoted Hep B education and awareness. We also did like a little digital campaign where if anyone wanted to get hepatitis B testing, they would just reach out to us and we would set that up for them with like a local clinic. And it could be done during their convenience and it was still discreet and they didn't have to worry about showing up in a large group, a large social event. So we did that. We also partnered with Columbus Public Health, and they did some educational Zoom education for us. So that was another way for us to get the information out, so that we were still providing education and awareness, and still offering that testing that was definitely needed. Now, because things were changing pretty quickly, we did go ahead and we still had our picnic. We were not really so concerned about people not showing up to the picnic because of how the advertisement has been for this event. It's been pretty much word of mouth. So if you're not someone that's connected with the community, then most likely you probably would not have stumbled across it. So we did keep that. We did have a good turnout. Um, so that was so we yes, so we did do that. And another thing that we are still working on is we have a arts and culture event that's coming up in October. We decided we're going to provide Hep B education for that event because we just kind of felt like because we didn't get to do the big festival that we were so looking forward to do, we still wanted to provide an additional outlet to provide education, and then if people want to get testing. So we do have that. I don't know if anyone here on the call is in Columbus. If you are, we definitely would like you to come out to our event that we're having in October. It's on October 4th, and I have a flyer that has that information. So here are just some pictures from our picnic and a few various events that we've had throughout the year. As you can see, smiling faces. People were happy to see us, engaging with us. Nigerians love to have fun, to party, to eat, socialize. So I just kind of wanted to showcase some of that as well. And that pretty much concludes the end of my presentation. I have included my contact information. If anyone wants to reach out to me, my email address is there. If you want to check out our website, that is there also. And then we have a YouTube channel. Now, there was one thing that I did not mention with the education that we provided. And I did kind of look at the chat and I saw that there are a couple of Nigerians that are watching this. One of our YouTube videos, we did the education in a language called Pidgin. It's like a local dialect that Nigerians speak. So we wanted to also incorporate that just to kind of make it fun. So you can check that out on our YouTube channel. And that concludes my presentation. So thank you.
So I just put the link to their YouTube channel in the chat. And before I turn it over to my colleague Shreya to facilitate Q&A, I have a follow-up question on your presentation. When you and I were talking about some of the changes you all had to do because of just the concern of having such large events and not wanting to put folks at risk of anything that might happen in this day and age in a large crowd, what one of the things we talked about was how is like you almost had to there was this like shifting back to COVID time methods of digital outreach and really trying to get folks to sign up for those screenings instead of being able to go to where they were. Um, have you gotten a lot of pickup on that offering of essentially connecting folks like to get them into a clinic for their testing and then kind of like handheld from there? Has that ended up being an effective approach given how quickly you had to pivot?
I felt like it was effective because it also added, I felt like it added an additional layer of privacy that we probably would not have gotten at an open event. So that was a great pivot that I felt like we made and it was received well.
Nice. Awesome. Thank you. I was realizing like, wait, I'm not sure if that popped up, but I wanted to like unpack it some more. So excellent. All right. Well, I'm gonna turn it over to my colleague Shreya to facilitate the Q&A. Shreya, go for it.
Hi everyone, I'm Shreya. I work as the program coordinator for the Hepatitis B Foundation, and I'm going to be facilitating the Q&A session. Looks like we have one question in the Q&A box, and I think that's for you, Sanjay. It's from Madeline, and she wanted to see if you could provide the flyer. Um, um, they're from the Columbus area and would love to share this event with their local health department. Sanjay, if you could provide your email, I can share with the participants, and if there are questions for you after the session, they could potentially reach out.
Okay, sounds good.
Awesome. Okay, so if you all have any other questions, please drop it in the chat or the Q&A box. But since I don't see any, I have a couple prepared, so I'm going to ask one. Sanjay, have you had issues when trying to build trust with a lot of communities that you serve? Have you seen hesitancy come from them? And if you have, how what are what are some of the strategies that you've used to tackle them?
So we made a conscious effort for the events that we were doing. We wanted to make sure that the events included like food and music because what better way to be able to talk to someone about a serious subject when they're in a good mood, when they're happy, they've had some food, they're dancing. So we felt like that was a great way to um, present the education.
That's great. Frank, I don't know if you have information. Did Dr. Zhang drop out of the
Nope,
group? She's
I think she's
here.
right here. Yeah.
Oh, she's right here. Dr. Zhang, did you have any insights? Have you seen any hesitancy from the communities you serve and some of the strategies you guys have used?
A lot of phone calls, a lot of reminders. It's often needed. Hesitancy about screening is better than vaccination. Because of vaccination is you have to do twice. Um, uh, it's a, you should uh, the clients were identified no immunity, Hep B negative. We encourage them to come in for vaccination. Sometimes we schedule the events really well because we do like 2 weeks or 3 weeks after screening. We know the clients will get the result. We call them, but sometimes clients will come not right away. They may come later days. Uh, so it just make sure the clients come for the vaccination to get the message out how important for them to um, to get vaccinated and have those doses needed. That's the best way to protect themselves. Another thing is I wouldn't say the hesitant for the screening, but but knowledge, how important to get the screening, especially for the family members. They already get vaccinated, get screened, and um, they probably don't realize they in their lifetime they need more than one time screening or vaccination. So we try to get message out. Um, the we a lot of times we tap the university students who have time. They want to have experience in community health, so they will help us to do some research. What's the good messages to send out? We do monthly message sending out through WeChat, through Facebook, and other means. Yes, so we do. Hesitancy is one thing. People may do not want to know their status. Do you know what I mean? They would like to um, if they don't, especially if they don't know what's the solution, what the treatment. Um, and knowledge is another thing. So, two things you have to work with a community.
Thank you so much for that, Dr. Zhang. We have a couple of questions for you, Sanjay, in the Q&A box. So, how are you keeping records of the number of people that you have connected to when you are using digital outreach, and how are you reporting it? And also, are you able to keep track of percentage of people who signed up are actually coming in for screening?
Yes. So what we did was we had people sign up by sending an email. And that was how we were able to keep track of who was interested. And with the clinic, we set up the appointments for them. We were able to do that. So I think that answered your question. I don't know if there was a part two. Might have been something else I didn't answer.
Also, are you tracking the results to report on the impact of awareness and screening programs funded by the HBU grant?
Okay, so we did not track the results. Our main priority was to provide people with testing. Now, if the clinic, however they did that, we did not facilitate or interfere with that.
Okay, thank you for that. I don't see any other questions in the chat or in the Q&A box. Dr. Basu has raised her hand. One second. Dr. Basu, are you able to talk?
Yes.
Awesome.
Thank you so much for answering my questions. I think I had a little bit of follow-up to that question because I know that a separate clinic is doing your study. This is something I need to know because we are also setting up clinics, setting the screenings up in the clinic, and people do sign up in our health. We go to health fair events in New York City. But when people sign up, there's not always like even though they sign up in our clinic, when we make the appointment for them, there are some people who will not show up. So is this something that happens? How do you keep, that was my question. Like, does the clinic report back to you on how many actually came in for the appointment? Or is this something that you're not seeing at all?
Okay. Well, we offered the free testing, and in order for it to be free, we had to pay for it for anyone who was interested. So that was also a way that we were able to track who actually received testing, but we just did not track the results. So I hope
So
that answered your question.
I think it mostly did. We are getting them tested, most of them through their insurance. A lot of the insurances actually cover it. But also the rest of it, the uninsured patients are covered by the clinic and our agreement with the diagnostic company. So, but we are still going through this issue of people sometimes not showing up to test. So that was mine. But I thank you so much. I think I got what I was looking for. My question, I mean, my worry is how it would affect the reporting in terms of, grantees. Is this something that needs to be, if people don't show up, there will be like a gap between the number of people signing up and the number of people that we were actually able to test. So are those things that we are going to report? I think I have lots of questions, but I can keep those separately. Maybe I can set up a separate meeting with Shreya to go over those.
Of course, Dr. Basu, and please feel free to reach out and we can set something up.
Okay, thank you so much.
Thank you. Thank you, Sanjay. Thank you, Dr. Zhang, for attending today's session. Thank you, everybody, for attending today's session. As Frank mentioned before, we will follow up with everybody with the slides and the recording from today's session. In the meantime, if you have any questions for us, if you want to learn anything more about Hep B United or the kind of programs we do, kind of work we do, please feel free to reach out either to Frank or myself, and we'll be more than happy to set up a meeting with you. And yeah, thank you so much for attending, and hope you all
I just have one last question. I'm really sorry. I just realized that we just actually found out that we have received the funds. As you know, I have reached out. We were the funds were lost. We found that out. They're asking if this is a city funding or federal funding. That was the question they had.
I think this question would be probably better if Frank answers it. So when we're setting up a meetup with Renew and us, can we discuss that then, Dr. Basu?
Sure. Thank you so much.
Thank you. Thank you. Thank you, everybody, for attending. And yeah, keep an eye out for the recording and for the slides from this session. And we hope we'll see you soon in one of our other sessions. Thank you and have a great day. Bye, everyone.
Bye.